Hi, I'm Matthew Huffman, Public Affairs Director at MCADSV,
Hi, I'm Havana Watkins, Partnership Development Coordinator for MCADSV.
and we are 2/5 of the prevention team here at the Coalition. So Havana and myself serve on that team, along with Nora Mosby, who is a Member Services Specialist, Megan Owens, who is our Public Information Associate, and then Samantha Gormley-Hill, who is our Legal Resources Specialist. We are representative of a cross-section of our organization, where I really provide a little more oversight. Megan really focuses in on our messaging. Nora is our main connection to member agencies, and Sam leads our work on our sexual harassment prevention project. Havana, tell us a little bit about what you do.
So in my position, I am happy to be the face that will join all of these partnerships together. So with our member agencies, our national partners and resources, I'll be coming out, I'll be meeting you soon, and we'll just try to connect everyone with the resources and the support that they need in the community.
So this is a special edition of the latest newsletter because we are really focusing all the articles around benefits of membership. And Havana and I are going to talk with folks today about what that really means when it comes to doing prevention work. So a big part of that is being able to take all of the national research that is coming out about best practices around prevention programming, what we know to be effective prevention strategies, and then translating that to make it really easy for prevention advocates to develop programs that meet the needs of their community without getting too heavy into public health jargon that can be kind of off-putting for folks. So the first thing that we really like to talk about with anyone at a member agency looking to develop a prevention program or really expand their prevention programming is to start with that public health approach. So Havana, whenever you hear a public health approach, what does that mean to you?
So with a public health approach, the first thing I think about is how that's going to affect the community that we live in, the community that our members live in, and what can we do under that lens, under the health equity lens, to make sure that the people in our community are getting whatever it is that they need. And what they need has to be different for each community. So urban areas is different than more rural areas and vice versa. So we try to find the ways to help each community in the distinct ways that fits the members' community that they're serving.
Yeah, that is such a great point, Havana, that a big part of what we do is really help member agencies identify a prevention approach that works for them and then help them adapt it to their own community. And we know that Missouri communities look really different. So even if we know there are certain strategies that are shown to be effective at preventing gender-based violence, how folks implement that is going to have to look really different.
Absolutely. So that's kind of where I step in. So when I come in as a partnership development coordinator, I want to help you as a member, pardon me, connect with those in your area to help you figure out what the best game plan is for the people that you serve. Because what's helping us here in our region may not help you. So let's get those partnerships together so you can be supportive with the community and provide them with everything.
Yep, that's a really great point, and a really exciting part of your job that you're going to be able to help members with. That's such a really important benefit of membership, is having that connection to coalition staff, having that connection to our prevention team, and being able to really get that assistance in developing programs that meet your community's need.
Absolutely.
So talking a bit about the steps of the public health approach and how we really break those down into manageable things that people are able to use in their prevention programming. We know that step one is about surveillance and really defining the problem. So a way that we help members with that is they are all collecting their monthly service report data, and then that really helps them identify who in our community is experiencing violence, how are they experiencing violence and the types of violence they experience. And also it gives folks an idea of how survivors and their families are connected to their program. So it also really helps people figure out, You know, if we know that there's a really high population of Latinx individuals in our community, but they're not coming to our program, then that also lets people know, wait, maybe we need to do a better job providing outreach to the Latinx community so that they know about us as a resource. So it's not only about identifying exactly who experiences violence and how often and the types of violence, but also what pockets of our communities might not be being served because they're just not connected to us. And Havana, I think that's such a really important aspect of the work that you do, really trying to identify stakeholders in communities and helping get those folks connected and build those partnerships.
Absolutely. I would definitely agree. That's very important because sometimes when you're working in these member agencies, you don't really have the time to go and make those connections. So hopefully I will be able to make those connections and then bring you both to the table so that we will be able to serve that community that's probably being overlooked or is in need of something. And maybe we can help create a special service that you all have not thought of, because for whatever reason you haven't thought of it, but now we've got the stakeholder, we've got you, and collaboratively we can come together with a plan so that we can reach that part of the community that is in great need of our help and support.
And I think that that's such a really great way of leading into steps 2 and 3 of the public health approach, of beginning to identify what those risk factors are in the community that lead to people experiencing violence, but then also really being able to identify what are those protective factors that help keep people safe? How do we really work to promote health equity, healthy relationships, healthy sexuality education? Those are all things that really protect people from experiencing violence. And once you've identified those risk and protective factors, then it's much easier to develop and implement prevention approaches that really meet the needs of those communities. And so, Ivana, that's such a great way of you describing how we bring people to the table and bring more people in to develop these partnerships that will make lasting change.
Absolutely. Members, you guys are the experts of what works in your community and what doesn't work. So if we can combine what works and with someone who understands the need, together we can do something even better because we're coming together and using our great minds to make such a great impact. So that's, the hopes of this whole team is to be able to get everybody to work in a collaborative way and not working against each other, but working with each other.
And I think that that's such a really important part of this, is that we're all working toward the same goal, right? We have a mission at MCADSV of uniting Missourians to end rape and abuse. And so that's really at the heart of our prevention efforts, keeping people connected and supporting one another. Havana, I know that you've been doing a lot of research on kind of innovations in the field, what we see happening in other states on the national level in terms of really effective prevention strategies. So can you talk a bit about those, what you're seeing in the field?
Sure, yeah. So working here has allowed me the chance to watch webinars and attend trainings that Prevent Connect usually post in our national coalition, like the resources. And when I look at like what things are being done on the national level, I can take back all of that great information and then I can bring it back to you as our members. And let's see what we can do to make it fit for you. What can we do? What approaches can we use to try to take a little bit of it, but critique it so that it's unique for your particular program. We can translate into your particular community and by trial and error, figure out what works. We can try something. If it doesn't work with this partnership of collaborative partners that we have, then we can try something different. But if we're looking at things on a national level, the way they do it, there's always a way that we can mimic it on a smaller state level. We also are working on like the new economic support for our women with the Medicaid expansion, and another preventionist, Nora, and I are working really hard to try to be able to bring that information to you all so you'll know what your members what your clients are going to be able to look for, how to help them navigate that. It's just so many things and so much information out there. My hopes is that our team will be able to grab what's really important and be able to help you with those things that are unique for your agency and can be provided for you.
I'm really glad that you mentioned the work that you and Nora are doing around Medicaid expansion and providing economic supports for women, because I think we also really need to consider our prevention efforts as health equity efforts. And y'all are doing really amazing work at looking at, what are some of these different social factors that can lead to violence, that can keep people in a violent relationship. And so really thinking about things like access to health insurance and access to healthcare in general, looking at things like economic supports and independence. Those are really important factors that help prevent violence from ever occurring. And that's such a really important upstream thing for us to focus on.
Absolutely. You have to think about it in the light that sometimes when you know better, you do better. And if they don't know, then I feel like if they're in our presence and we can help them, at least we can kind of help them not have to deal with one more thing. So there's one less barrier we're taking away from them so that they can feel protected. They can feel like they can have somewhere safe to be, somewhere to get help when they need it, when something unfortunate may happen health-wise. So if we're taking away those barriers, that is part of prevention, because we're preventing something in the future from being able to happen, or in the sadness that something does happen, they know what steps to take to get the help and the support, whether it's mental, physical, or health-wise. They'll know that, hey, I know that I could probably qualify for this. I can go here for this particular resource and I can get it. And then hopefully things will look better for their outcomes.
The other thing that I think our team does a really great job of is staying connected to member agencies and hearing from them. Here's what we're doing with prevention advocacy in our community. Here's what's working really well. Here's what we need to adjust a little bit. Nora does a great job of facilitating our prevention capacity building cohort. And I know that the two of you have been working really closely on identifying how have prevention folks had to change their efforts in the middle of the pandemic. So will you talk a little bit about that and just the importance of keeping members connected right now?
Absolutely. I think we really look forward to this monthly call. I wish we could have it more than once a month, but our member agencies are doing unique things, and being able to learn from each other is really good. Like COVID hit, nobody expected it. Nobody really planned for it. How in the world can you do prevention through a computer with kids that you're trying to keep concentrated? Well, guess what? Believe it or not, our member agencies had wonderful ideas. We were able to come together and share how to get creative, how to do things to connect with them, not just when it comes to talking about prevention, but also when it comes to talking about how they're feeling. Their social emotional wellness is a very big part of prevention as well. And then we were able to reflect back on some of the tools that we learned from Prevent Connect. Watching that webinar, we were able to bring in some tools of different ways and modalities. You can make it fun, how you can get creative. The first 15 minutes of the Zoom, let's compare yourself to an animal. What kind of animal are you feeling like today? Just coming up with creative ideas to get their minds thinking, get them out of the box of here we go again with another Zoom call. So as member agencies, we're able to come together with different ideas and learn from each other and share. And then when you hit that roadblock, hey, I remember somebody mentioned something that they were doing, and you could just send an email to somebody that you've already connected with.
I think that that's such a really great way of talking about member benefits and being able to highlight two of the core services in our mission of alliance. So keeping members connected, being able to share in their successes and learn from one another and really lift up and amplify the work that they're doing, but also really being able to highlight research as a part of our core mission. So the work that you and Nora and Megan and Sam are doing as the prevention team, taking all of this research from the national level, what we know to be best practices, and then really helping members research the needs of their own community and adapt those strategies to what's going to be best for them.
Absolutely. That's what we're here for. And we can brainstorm with you of what works, what doesn't work. Like you can call on other member agencies. You can call on us like anytime. You can send us an email. You can give us a call. And what we'll do is figure out, well, what have you worked with before? What hasn't worked? Well, have you tried this? Or what do you have the capacity to do? Because what we may think you can do, you may not be able to because you don't have the capacity. So we'll find creative ways to lean on each other. Or perhaps if two member agencies are close, they can partner together and work together, and one can take one part of it, the other one can take, that way the time and the effort is split evenly between two agencies that want to do this amazing work. So I think it's really important to be able to do that.
Yep, 100% agree. Well, from all of us on the MCADSV prevention team, specifically from Havana and myself, we love talking to members. We love hearing about the great work that you're doing. And it's a benefit to us as well to stay connected to you and hear what you're doing on the local level. So with that, we really look forward to working with you in the next year.
Yes, see you soon.